The discipline of public health medicine, which is based in School of Nursing and Public Health in the College of Health Sciences at UKZN, takes its origin from the discipline of community health, which was originally started at the beginning of the medical school by Sydney and Emily Kark. And they actually started community health working with the local communities in and around Durban, promoting population health. And so our large focus in terms of public health medicine is to address illnesses and diseases which are affecting population health. We don't only just focus on the communities around us in Durban, but we do quite extensive work across KwaZulu-Natal. And in doing this work, we work with several research partners, which include international funders from the European Union. We have funders such as Bristol Myers Squibb Foundation and the United Kingdom's National Institute of Health Research, and also the American National Institute of Health. In addition to our international funders, locally we collaborate with the Provincial Department of Health and also the municipality and various districts. All of our projects are focused on priority conditions in terms of what the Department of Health, both at national and provincial, have identified, such as long-term illnesses and chronic diseases, including cancers, the more recent effects of climate change on population health, and also adolescent health.
Teaching and learning in higher education is an exciting field. In public health medicine particularly, the focus on the population perspective is something that we are passionate about and try to bring to our students, because we often find that students start off from a very individual perspective, particularly our undergraduate medical students who are being trained to work within a one-on-one consultation. But in developing their lens towards a public health perspective, we try to make them understand how they are part of a wider system, how there are interdependencies in the system, and how these strengthen their ability to communicate and understand patients, as well as get a population perspective on health. With Masters in Public Health supervision, we aim to help students realize their full potential in terms of developing critical thinking and their ability to develop confidence in themselves as leaders. We take them through, or we try to adopt an approach that does not reflect our own voices, but rather the voices of our students. And we help them to find their niche in public health and to grow to be the best leaders in the healthcare system that they can be.
In terms of research, I am part of a team that is researching lung cancer through the Multinational Lung Cancer Control Program, MLCCP, and cervical cancer, where we partner with local organizations. And so what I love about these projects is that we're working closely with communities. So in the case of lung cancer, we've partnered with Cancer, which is Cancer Association of South Africa. Really what we're doing there is we want to streamline the process in terms of pathways of care, so that patients that are diagnosed with lung cancer are diagnosed early, first of all, and once they are diagnosed, they access treatment early as well. Because what we know about lung cancer right now is that a large chunk of patients that are diagnosed with lung cancer die while they're on treatment. Why? It's because they are diagnosed late, where treatment is no longer effective. And so what we want to do is we want to diagnose them early, but also we want to encourage them to present early, so that when they recognize symptoms, they do not delay going to the healthcare system and seek help.
The Weather Project is a grant that we have that's funded by the United Kingdom's National Institute of Research and Health. And this project is focused on actually setting up and implementing an early warning system, working with communities in the Durban South area and in Ugu. We will be using historical climate change data to look at weather patterns over the past few years, and then collect new weather data to build this early warning system, where we'll be able to inform certain role players like the Department of Health and also the local municipality, but also through an SMS system and a WhatsApp program, able to inform local communities in terms of when they're likely to expect an adverse event. And these adverse events may be flooding, it may be snowfalls, it may be high temperatures and heat waves. Coupled with that, we will be working with the Department of Health to conduct facility audits to establish just how prepared these facilities are to be able to respond in these adverse events. So really what we're looking to do is to build the resilience of the health system to respond in adverse events. And coupled with that, we will be actually training healthcare workers on how to respond, but also working with local communities to help build their resilience. So this is a 4-year project, which is very transdisciplinary, because we're working with the Department of Maths and Stats and Computational Science, focusing on the AI aspects of the project, and then there's public health, and we're working also with geography to looking at the geospatial mapping and dealing with the weather data as well. So very transdisciplinary. And from it, we intend to, or at least our intention is, to actually train several doctoral students and master's level students with the relevant skills, so that they can actually work with communities, the Department of Health, departments with disaster management, to address future adverse events.